Assalamualaikum and hello to Ms. Farah. So we are from Group 4, which for today we would like to present our assignment for subject application of maritime environmental, occupational safety and health law. So basically our theme for this assignment is hospital or healthcare system that are viable in Malaysia. So my group member consists of Nushahada binti Ahmad, Mubtila binti Usman and Siti Nur Hikmah binti Hamidon. Without further, I pass to the next presenter to continue this presentation.
Our staff in this assignment shows 10 different sections and regulations from Occupational Safety and Health Act 1994 and Factory and Machinery Act 1967. So for all these acts and regulations are relevant concerning to DMOSH legal regulations that are compliance at the Kuala Lumpur Hospital. And for recommended control measure to Safety and Health at Hospital Kuala Lumpur, such as administration of control and personal protective equipment. For administration of control, such as all workers and visitors must follow standard operation procedures that provided at Hospital Kuala Lumpur. Fire preventing tools and plan are required in workplace area. Employers need to report occupational disease to DMOSH and providing adequate training to the workers. For the second recommended control measure is personal protective equipment such as provided mask, glove, and jumpsuit to the workers at Hospital Kuala Lumpur.
Okay, Assalamualaikum. My name is Siti Nur Hikmah. So the hospital that we chose is Hospital Kuala Lumpur, which is one of the largest hospital in Asia under Minister of Health. So Hospital Kuala Lumpur objective is to provide safe and quality customer and to comply with applicable requirement through continual improvement of the quality management system. So in Kuala Lumpur, Hospital Kuala Lumpur has 53 different departments, include administration and finance department, the pharmaceutical, training and research, 28 clinical departments, also 12 clinical support service. It has 7,000 workers with 100 professions in various fields, 200 consultants and specialists, 500 medical officers and registrar, 32 matrons, 3,101 registered nurses, 253 community nurses, 6 trained assistant nurses, and 1 trained midwife. The remaining workers, which is pharmacists, tutors, medical assistant, administrative personnel, and hospital attendants. So according to our research about work activities in healthcare and hospital, there are 5 overall work activities, which is keeping healthy process, detecting health problem, diagnosing diseases, treating disease, and providing for a good end of life. So based on the Hospital Kuala Lumpur, there are 3 services, which is management, clinical service, and support services. Okay. Next presenter. I'm going to proceed with objective of this assignment. So the first thing first is to show all the work process at Kuala Lumpur Hospital, how they fully complies with legal regulation that we have in Malaysia, especially for Occupational Safety and Health Act 1994 and also Factory and Machinery Act 1967. The second objective for this assignment is to show method or relevancy of the regulation that has been stated at the above at the Hospital Kuala Lumpur and how they use this regulation to protect their employees from any safety and health risk without neglecting their welfare at their workplace. Next. Okay. I'm going to continue with the first part of the law and regulation. Number 1 is from Occupational Safety and Health Act 1994, Part 6, Section 24, Subsection 1C. The title is General Duties of Employees. The specification or the summary from the legislation is the employees are required to use and wear protective equipment that has been provided by their employer at workplace to protect themselves from any risk at the workplace. So the area that can be this regulation can be complied is place of work, which is like the whole HKL. So the person in charge in this matter is the general director and safety representative at the HKL hospital. So the relevancy of this regulation to these matters, all doctors, nurses, and everyone at the hospital Kuala Lumpur is mandatory to use and wear all protective equipment that has been provided to them by the employee or the HKL authorities. This is to make sure that they are protected as maximum as possible from any health and safety risk at the HKL. The second laws and regulation also from OSHA 1994, Section 4, Part 4, Section 17, Subsection 1. So the title is General Duties of Employers and Self-Employed Person to Person Other than Their Employees, which means the responsibility of employee or self-employed person toward the person that not registered as their worker at the HKL. As simple that we can see it, the visitor maybe at the HKL hospital. So the specification of this regulation is the employee and self-employed person has an extra responsibility to ensure that no one other than their employee at the HKL exposed to any health and safety risk at the HKL. So the area that this act can be complied is at the extra department and contagious disease ward. The person in charge for this matter is safety representative. So what is the relevancy of this law and all this matter that I have been saying before this? The exposure to what visitor must keep to a minimum as much to make sure that they are following all the complete procedure that has been provided by the HKL authorities to protect themselves from any health and safety risk at the HKL. Next. Number 3 is the Factory and Machinery Act, Part 2, Section 11. So the person exposed to explosive, inflammable, etc. substances. This is a proper countermeasure must be done to protect workers that exposed to explosive, inflammable, poisonous, corrosive substances or ionizing radiation. This law and regulation can be complied at the X-ray room. The person that in charge for this matter is a safety representative at HKL. So the relevancy of this regulation to HKL, all workers that work in X-ray room must be provided with proper protection and required to follow all the SOP that has been made by the HKL authorities. This is because X-ray is one of the ionizing radiation that can be found in the HKL. The last part from me is also from Factory and Machinery Act, Section 2, Part 2, Section 13, I'm sorry. So the title is Provision Against Fire. The summary of this regulation is premises, which is HKL, must take caution step against fire, and it is required by the authorities or the government. All the fire escape plan and equipment must be available in the HKL and well maintained. As we know, for example, for fire preventive equipment, we have, for example, fire extinguisher and fire sprinkler. So the place that can we comply this regulation is place of work, which is like the whole HKL building. So the person in charge is General Director and Safety Representative at the HKL. The relevancy of this regulation towards this matter, HKL whole building are required by the authorities or government to prepare fire preventive and fire escape plan. It is including the emergency exit and well-maintained fire extinguisher and other fire preventive equipment. That's all from me.
For law and regulations, number 5 is Occupational Safety and Health Act 1996. In Part 8, Section 30, Subsection 1A is Establishment, Safety and Health Commit at Place of Work. So for any workplace that have more than 40 workers, employees are required to form safety and health committee team. These acts and regulations suitable use in place of work area. For person in charge is General Director of DOSH and Hospital Kuala Lumpur authorities. And the relevancy is Hospital Kuala Lumpur have 7,000 workers as recorded. This make they are required to form safety and health committee. For another regulations is Occupational Safety and Health Act 1994 in Part 4, Section 15, Subsection 1, General duties of employer and self-employed person to their employees. For the summary is provide and maintain a safe and healthy working environment at workplace. And this regulation is suitable using in surgical ward area. For the person in charge is medical doctor and safety representative. And the relevancy is provide training and welfare to health workers at Hospital Kuala Lumpur on basis usually appears at work such as ergonomic problem. After that, workers also must practice a proper way to relieve patients and heavy loads using a trolley or stretcher. Another regulations related to our assignment is OSHA 1994, Use and Standard of Exposure Chemical Hazardous to Health 2000. In Part 2, Section 5, Subsection 1. The title is Identification of Chemicals Hazardous to Health. So the summary is employer need to identify and register all chemical hazards that be used at workplace and record all chemical in register list chemical hazardous to health. And the area is patients room and bedrooms. For person in charge is safety representative, and relevancy is any cleaning chemical are used at Hospital Kuala Lumpur for cleaning activities. Disinfect and sterilize work must have registration of chemical to prevent exposure risk towards healthcare workers, patients, and others. Thank you for me. I pass the presentation to the next presenter.
Okay, for the next law and regulation that being complied in HKL is Occupational Safety and Health Act 1994, Part 4, Section 16, which is duty to formulate safety and health policy. So the summarize is from this regulation is to prepare general statement of intent of policy, including management's commitment, provide list of goals and objectives, list of responsibilities and accountabilities for achieving those goals and objectives, including those of management, supervisor, and workers, prepare an outline of the safety program and procedure, identify the method of review the policy. So for the that area that must be complied for this regulation is under Administration Management Department. So the person in charge is safety representative, and the relevancy is the general director and deputy of Hospital Kuala Lumpur required to implement regulation for all the workers and devote to their objective and responsibilities. Okay, the next one. Okay, the next one is under Occupational Safety and Health Act 1994, part 4, section 15, subsection 1, 2, and 3, which is general duties of employers and self-employed person to their employees. So the summarize is to provide and maintain a safety and healthy working environment in the office, provide adequate training in related to the safety and health to all workers, prepare safety and health procedure or manuals, provide, maintain adequate facilities and welfare for the worker. So this regulation must be comply area human resource department, and the person in charge is medical doctor and safety representative. So the relevancy is the all employees and employees of hospital Kuala Lumpur require provide with full training in medical and provide with function safety facilities. Okay, the last one is under OSHA 1994, part 6, section 24, subsection 1 and 2, which is general duties of employees at work, cooperate with employer in maintaining safety and health requirement, wear any PPE provided by employer, comply with any instruction on occupational safety and health imposed by employer. So this is under clinical department. This person in charge is safety representative. All employees in hospital Kuala Lumpur require attend training and shows the responsibility to employers by follow all regulation and acts that provided. Okay, that's all. Thank you from us, Group 4.